Hi, my name is Andrew Wong, and I'm a professor of medicine here at Duke University Hospital in Durham, North Carolina. And I also direct our Hypertrophic Cardiomyopathy clinic and program. I want to take this opportunity to thank the Hypertrophic Cardiomyopathy Association and Lisa Sahlberg and Stacy for organizing this HCM day. It's really our pleasure to be a part of it and to update you all about some of the things we've been doing here, some of the new people in our program that you're going to meet in just a minute. I'd also want to take a chance to recognize the patients and their families with hypertrophic cardiomyopathy. I know that the disease itself is a challenge in terms of getting good advice and information and expert care, which is why the HCMA is so important in their advocacy and helping patients navigate many of these roadblocks. So I want to take a chance to recognize our patients and especially what they've been through in the last few years of the pandemic. I've seen a lot of the stress that our patients have been through, and I just want to take a moment to recognize the difficulties and say that we're all trying to help. So I'm pleased to have this opportunity to talk about some of the updates in our program, and I'll just mention the background a little bit and sort of where we are now. So I started seeing patients with hypertrophic cardiomyopathy about almost 20 years ago, and it's really grown as the information and the therapies for this condition has grown as well. We have a full day clinic every Monday and a new clinic building that just opened a few months ago. So that's one of the other updates that we have, and really have a comprehensive care of patients with hypertrophic cardiomyopathy, and have been recognized as a center of excellence by the HCMA for the last several years, thanks to Lisa. The two things that I'm most passionate about, I would say, are patient education. I think that it's hard to understand the complexity of hypertrophic cardiomyopathy and the treatment options that we have for the patients. And before the pandemic, we would hold almost an annual or every other year patient education day here in Durham, North Carolina, and really had a amazing turnout of number of patients and their family members. I think the last time we had it in downtown Durham, it was over 200 patients and their family members. But that was obviously before the pandemic. We look forward to getting back to that when it's safe to travel and gather together. The other thing I've been passionate about is evaluating novel therapies for hypertrophic cardiomyopathy. And we've been part of the clinical trials of many new drugs and therapies for hypertrophic cardiomyopathy, and most recently for the myosin inhibitors. We were part of the pivotal trial of mavacamten and are involved in the clinical trials of aficamten as well. And I think I've seen the benefit for many of our patients who are very much engaged and want to be part of these clinical trials to see the progress in the field and new treatment options for patients with hypertrophic cardiomyopathy. So that's my update, what I'm interested in. I hope to see many of you in person. I'm going to now introduce you to two people, and the first will be Dr. Carmelo Milano, who is a professor of surgery here at Duke Hospital, a close colleague of mine. He's also the section chief for adult cardiac surgery. He is our expert in myectomy and addressing the complex nature of outflow tract obstruction surgically in patients with with hypertrophic cardiomyopathy. So I'll let Carmelo tell you what his focus and interests are.
Thank you, Andrew, and it's a pleasure to be involved in our Center of Excellence for Treatment of Hypertrophic Cardiomyopathy. Over the last several years, I have performed the majority of myectomies at our center, although we have two other surgeons, Don Glauer and Jeff Gesa, who are also very experienced. I am passionate about treating patients with hypertrophic cardiomyopathy, and I think one of the neat things is that each patient is very unique and has very unique features, and I think each case has to be dealt with in a unique manner. Some areas of surgical interest of mine. First, management of mitral valve insufficiency in patients who have hypertrophic obstructive cardiomyopathy is a dynamic topic, and there are a variety of different strategies, and I think that is still a challenge, and I think we're still learning how best to deal with the mitral insufficiency. Oftentimes, we don't have to deal with it. Oftentimes, just addressing the obstruction with myectomy resolves that problem. Another area of interest of mine are those patients in whom the obstruction may be deeper in the ventricle and not in a location underneath the aortic valve. Some patients have obstruction in the middle of the ventricular chamber, and sometimes there's obstruction at the very apex. And some of those patients can be best served with a different approach, which is through the left ventricular apex. The myectomy, the ventricular reduction can be performed through an incision in the LV apex rather than through the aortic valve. Finally, I'm also very involved in the heart transplant program, served as the program director for many years. Duke is one of the busiest heart transplant programs in the world. And each year we treat a number of patients with hypertrophic cardiomyopathy. And in general, these are patients who really don't have a lot of other health conditions. Their primary condition really is their cardiomyopathy, and they do very well with heart transplantation. So each year we get to treat a number of patients with cardiac transplantation. So again, it's a pleasure caring for patients with hypertrophic cardiomyopathy, and I find it one of the most interesting parts of my practice.
Thank you very much, Carmelo. And again, thanks for all your help with our patients. I'm now going to introduce you to Ms. Caitlin Amos. She's a certified genetic counselor, and we've been very fortunate to have her join our program in the last year. So she is really a big part of our outpatient hypertrophic cardiomyopathy program, and we've kept her very busy seeing patients both in person and virtually. So thanks, Caitlin.
Yeah, like Dr. Wong said, my name is Caitlin Amos, and I am a new genetic counselor working here at the Adult Cardiovascular Genetics Clinic at Duke. I'm really grateful to get to work alongside Dr. Wong in our HCM clinic as we care for patients and their families with hypertrophic cardiomyopathy. In my job, I think I'm most passionate about, like I said, working with Dr. Wong to help patients adjust to their diagnosis. Sometimes there's a big psychological and emotional component to that adjustment, and then also help them care for their at-risk relatives. My hope is that I'd help patients and their loved ones understand who else is at risk for developing this condition, so they can feel empowered and confident to take the necessary steps to care for themselves and their families. I know Dr. Wong said this, but I'm super grateful for the HCMA and the resource it's been for the patients I've worked with so far, as it's helped them learn about how to live with HCM and feel not alone in that process. I think it provides invaluable support and connection for individuals. And we talked about this before, but feel like it's the sort of poster child for patient resources and different indications. So thanks, Dr. Wong, and thanks, Dr. Milano.
Yeah, thank you both. So I want to again wrap this up by thanking everyone at the HCMA, thanking the patients and even many of the sponsors in industry who are really trying to move the field and the treatment of patients with hypertrophic cardiomyopathy forward. So thank you all from Duke, and hope to see you all in person soon.